Anyira kera wope me atin pe adop. Are you ready?
Yes.
If you fair witness. Anyira kera wope me atin pe adop. Are you ready?
Yes.
I'm eti kwa pe. We agwako kanu wa. Kiri kui agwako konwa. Ilawe. Kero gina ngao ke koba uno kwa wi. Ilawe ri wano gamo penyin gamo mere obero gamme chwechwin. Ejwane wano gamo penyin gamo mere obero gamme. Ikwe agwako komi kero shiri komi tekelo tuobo chene mecha.
Yeah, I'm Okiri John Achan. I'm one of the VHT in Achorpi Parish. I'm also one of the peer supervisors leading a group of VHTs within the parish. And my parish is comprising of 24 villages where I have to monitor all the programs that the VHT are performing. Okay. This is just the usual trust condom that we will be giving to people who are in need, and those who don't, at least you try to talk to them so that they use it.
VHT is a concept of the Ministry of Health that stands for Village Health Team, and it has been programmed to support the implementation of health services at a community level. They control approximately 30 households per village health team.
This is the recommended dose for this child. Yeah, it's 6. Okay. So for the children ages than this one, it's 2. 2 in the morning, 2 in the afternoon, for 3 days. Okay. The programs we are faced with are distribution of medicine to children under 5, and condom distribution is also one of our tasks that we give to the youth and other needy, or even to the infected people, for avoiding reinfection to their, could say, partner. And other programs that we are faced with is on sanitation. Those are the programs that AMref is carrying out with our people around.
Northern Uganda has been devastated by war for the last 22 years. And with war comes the destruction of all health infrastructure and other infrastructure that there can be in society.
Access to health services is one of the key prominent issues. Government efforts alone cannot provide the much needed health services at the community level. So this justifies the need for partners like AMref to complement the efforts of the local government to provide health to the people who are returning home to their villages.
The village health teams are composed of 9 people, as I said. They are trained by AMref and the government. There's a curriculum which was developed by AMref and the government of Uganda, which we follow. They are basically trained for some few months on endemic diseases that are rampant in northern Uganda, like malaria, diarrhea, eye conditions, and we teach them on how to interpret symptoms and signs of diseases which they have to refer to the nearest health center.
I was one of the trainers for the VSTs, district trainers, and we train VSTs in all the sub-counties in Padea.
We are still going to move forward, and your coming is a clear indicator of the continuation.
It took us almost 2 years to complete the whole district. And right now, as I talk, the VST program is in all the sub-counties in Padea district, including the newly created district sub-counties.
Now, when the fever persists, when there is no change, after giving all this for 2 days, you just refer to the health facility for further management. Yeah, that is what I can say. Thank you. They had gone dispensing a child who had been having a case of malaria and cough, mild cough, that is cough without pneumonia. And there was also diarrhea. So The medicine given were coartem yellow, that is 6 for the complete dose for that child at the age of 1.5 years.
Definitely, without having these people trained and delivering their services, there will be a very, very negative catastrophe in this part of the country.
As a midwife, you know, some of the community, they like deliveries from home. But since the VST is around, they normally refer the mothers to us. They even moved around to help educate them about the importance of hospital deliveries.
You know, if these people are down at the village level here, sometimes factors like weather conditions and whatever makes it difficult to come and access the health center. But when this medicine are there with the members of the village team, it is first of all accessible. The other thing also is the friendly nature of the treatment that is given. You know, the health center is characterized by a lot of waiting, long queues and all that. But at a community level, when somebody controls around 30 households, is able to easily get attention. Then the other time also is the time frame when the treatment can be accessed. When these people are at a community level, they are able to access treatment at least within the first 24 hours of onset of fever. And that's very critical in handling malaria, particularly in children and in pregnant mothers.
The challenges that we are facing at AN is insufficient supply of drugs. I could say they are not adequate. And we are facing problem of transport. As I told you, I have to cover about 24 villages, which is so wide and cannot be done without any other reliable means. And we are just making a borrowing terms on bicycle. Other problems that we are facing is, I could say, facilitations, I could say support, because we have to work even day and night in the distribution of drug, because it can just fall any moment, so the mothers may come at your home as a volunteer, then you have to serve. So at night we are having problem of lighting system. And at rainy times we are also having problems in moving in the rain with the drugs as well.
Village health teams are not paid. Their members are not paid a salary. They are basically volunteers, and they are supposed to have that urge and motivation to help their people against the health conditions and diseases in the villages.
It is important to develop the health of the population so that we have also a healthy population, which also make the other development of the population around go rapidly.